Okay, you can do it. Okay. Good morning everyone. So we both are back with our live session of writing module.
Yeah, so today we are going to deal with the topic mastering introductions and strategic organizational approaches.
But before moving forward, we can wait for some time and let everyone join our live session.
Yes, ma'am.
Good morning, Arvind sir. Good morning, Varna. Hi, Vipin sir.
So hi, Abhi.
Hi, Aishwarya. Okay, now I think everyone started to join our live session, so we can start with it.
Yeah, so before that, let us introduce ourselves. So myself, Sandra Rose, and
I'm Anmol, and we both are OET trainers from Kochi, AJINORAH.
okay, so before starting our live session, so here we have a glad news for you that here recently our OET result is published. So we have 200 plus success rate other. So I congratulate all the students who have cracked the OET. Along with that, I will congratulate all the tutors who worked behind this.
Oh yes, it was a really teamwork from both the trainers and student side.
Yes, of course.
So now we can move towards our writing session. That is, you already know that we have 45 minutes of writing. Okay, in this 45 minutes, 5 minutes is for preparation. In this 5 minutes of preparation, you are not supposed to take your pen or pencil.
Yes, ma'am, because if you are touching the pen or pencil, it may like as a malpractice, and you will have a 40 minutes of writing. So in this 40 minutes of writing, you need to write the letter. Along with that, it is important to keep in your mind that you want to do the proofreading. So ma'am, could you please tell what is the importance of doing the proofreading?
Oh yes, proofreading is really important thing, because if you proofread your letter, you can avoid the mistake, punctuation or grammatical mistakes. You can avoid it.
Yes, that's absolutely correct, ma'am. So next we can tell regarding the criteria of the writing. So as you know that we have 6 criteria there in our OET writing. So the first one is purpose. In purpose, the main thing we need to say that it is important to give the reason for the letter. So what is the reason why we are sending the patient to the reader?
Second criteria is content. That means that required information for the reader to be written in the letter.
Yes, ma'am, that's correct. And the third one is language. So while writing the OET writing section, it is important to focus on the language, especially spelling, vocabulary and grammatical. So if you are making the mistake, there may be chance for reducing the mark. So you need to focus on that.
Okay. Fourth one is genre and style. It means what tone you are using or use of abbreviation. So when you say about the tone, like it should not be a combining word. Okay, we should be requesting. Okay, that is the main important thing that you have to see in your letter.
Yes, that's correct, ma'am. And fifth one is organization and layout. So in organization, that's depend upon the case note. While we are reading the case note, according to the importance for what is the purpose we are writing the letter to the reader, according to that we need to organize and lay out the writing module.
Okay, next our last and sixth criteria is concise and clarity. So we have to avoid all the irrelevant data, okay, according to the reader. So this is all about the criteria of writing task.
Yes, so ma'am, so shall we move to our case note?
Oh yes. Okay, so there are different types of letter. So can you please tell me what are the types of letters?
Yes, there are different types of letters such as referral letter, transfer letter, there will be like update letters, sometimes we can write as a home visits, there are some kind of types of letters are there.
Okay, so as you already got that what are the types of letter, so we can see what type of letter we will be dealing today.
Yes.
So we can see our case note, and the case note will be displayed on your screen. So this is the writing task.
Yeah, so we can go through the writing task. So in the writing task they have given, using the information given in the case note, write a letter of referral to Dr. Shah, consultant obstetrician, for further investigation, and address the letter to Dr. Miram Shah, consultant obstetrician, Royal Hospital, Lawtown.
Okay, so from the writing task, it's clear to whom we are writing this letter.
Yes, we are writing the letter to Dr. Shah.
Okay, and what is the purpose of the letter?
Yes, it's mainly clearly given in the case note for the further investigation.
Okay, so now we can move towards our case note, and you can just take your pens and pencils and note down all the information we are giving regarding the writing module.
Yes, actually this is not a live section, but this is a class for you. So ma'am, I think you can repeat it once more for them.
Okay, so now already a writing task is everything is clear about the doctor to whom we are writing the letter and the purpose, that is further investigation. Now we can move towards our case note. Okay, so we can see through the case note what is relevant and irrelevant information.
Yes.
Mrs. Olivia Hawthorne is a patient at your practice where you are a nurse. You has come to have her intrauterine device removed. So we can underline that information.
Yes, here this is really important one. Intrauterine device removed, because she came here for the removal of intrauterine device.
Okay, next moving to the patient details. Name Olivia Hawthorne.
Yes, I think that's a relevant point.
DOB 010479 40-year-old.
Yes, ma'am, that's a relevant point.
And what about address?
Ma'am, I think address is not needed to mention in the case note, because by knowing the address there is nothing to do by the reader, so we can eliminate that.
Okay. Next is our social background. Married, 2 sons, 7 and 5-year-old.
Of course, we need to mention regarding that.
Okay, but is it really important to say about the age of the children?
No, I don't think so, ma'am. There is no need to mention regarding the age.
Okay. Next is our active lifestyle.
Of course, ma'am, I have a doubt whether we need to mention regarding the active lifestyle like yoga teacher and swimming.
Okay, you can mention regarding yoga teacher and swimming. Maybe the intrauterine device may be misplaced or shifted during that time. So we can take it as a relevant point.
Okay, ma'am.
Next is smoker.
Ma'am, I don't think so that we no need to mention regarding the smoker, because she's a non-smoker, so she's not smoking, so we can avoid that.
Okay, so I want to tell you that this is a smoker and social drinker and vegan diet. So there is no connection with this information and our diagnosis. There is no connection with IUD and smoker and non-smoker. So we can completely avoid this.
Yes, ma'am.
Next is our family history. Father Parkinson disease.
Ma'am, as you said previous, there is no connection between that, so we can eliminate that.
Okay. Next is our medical history. G3 and P2.
Yes, ma'am. I think it is important to mention in the case note.
Okay. 2007 proximal DVT, right leg, 28 year, while long hours in stressful office job.
Ma'am, whether we need to mention regarding that, because there is no connection between the obstetrician and with this all these conditions, so I think we can eliminate this.
Okay. Still, ma'am, if you feel that it's a doubtful thing, that we can keep it aside and I will give you information regarding it.
Okay, ma'am.
Okay. So what about 2008 iron deficiency anemia?
Yes, ma'am, we need to mention regarding that.
Okay. Next is 2009 menorrhagia and dysmenorrhea diagnosed.
Yes, that's a relevant point.
Okay. 2012 third degree perineal tear.
Ma'am, I think it's a relevant point.
Isn't it? Okay, what about elective C-section?
Yes, I think we need to mention regarding that.
Okay, so I will tell you it's not relevant information because it is a normal thing that to undergo a elective C-section or third degree perineal tear. But if the patient was related to postnatal mother, so we can mention, okay, but in this letter it's not a relevant information.
Yes, ma'am.
Okay, so next moving towards our medication. Warfarin ceased 2008.
Yes, I think there is no need to mention regarding that.
Okay, because it's already stopped.
Sure.
Okay, ferrous sulfate 200 mg per day, Manning.
Yes, of course, we need to mention regarding this medication.
Okay. Next, reason for presenting. Removal of IUD as currently ineffective for menorrhagia and dysmenorrhea.
Yes, that's a really important relevant points in this case note, because this is the reason why the patient came here for the removal.
Okay. Next is our treatment record, that is 16/04/2007 proximal DVT in right leg diagnosed, warfarin prescribed, treated successfully and no further issues. Okay, as you know ma'am, I have already told you that you can wait for some time and I will explain you regarding why proximal DVT is not important. Okay,
yes.
so it's already written that it's treated successfully and there is no further issues. So we can completely avoid it.
Yes, ma'am.
Next is our 21/04/2009 menorrhagia dysmenorrhea diagnosed, menstrual bleeding 10 days, Cherupuzha prescribed, Cherupuzha prescribed. Is
Yes,
it relevant?
Yes, ma'am. We need to mention regarding that.
Okay. 22/04/2011 seed Cherupuzha to conceive child 1.
Okay, ma'am. Already it is seized. So whether we need to mention regarding this medication in the case note?
Oh, that's a really relevant information from your side. But I want to tell you that it's a relevant information because we are writing this letter to gynec and we have to tell about every information that include or that connect with the diagnosis. Okay?
Yeah, okay, ma'am. So we need to mention that.
Okay.
Okay.
26/09/2012, menorrhagia and dysmenorrhea worse than pre-pregnancy, combined pill, Silset prescribed.
Yes, ma'am. I think we need to mention that. Whether we need to mention regarding the same condition and again?
Okay, in that place you can use persisting sign or worsening signs,
Or
these are the
exacerbation of the symptoms.
yeah, you can use that words. Next, 02/06/2013, seed Silset to conceive child 2.
Yes, I think it is a relevant point because as you said, we need to mention regarding that.
Yeah. Next is 10/4/2015, menorrhagia returned with menstrual cycle, IUD Marina coil inserted.
Yes, we need to mention this point in the case note because this is one of the most relevant point in this case note.
Okay. 21/04/2018, menorrhagia improved. Okay. No more dysmenorrhea, no menstrual bleeding since fitting. Is it relevant?
Yes, I think so, ma'am. Whether we need to mention because it is already improved. So whether we need to mention regarding that?
Oh yes, but you can mention as his condition or her condition improved as evidenced by no menstrual bleeding since fitting. So that is a relevant question.
Okay.
Okay, next is vaginal thrush treated with canestrine 5 times since last appointment.
I don't think so. It's a relevant point. I think we can eliminate that.
Okay, that's a good question from your side. So I think it's really relevant because we are writing this letter to a gynec. So it's really important to say about this condition. So we can say. Next is our 2/4/2019, canestrine 5 times in last year.
Okay, I think it's a relevant point.
Okay. Next is our menstrual spotting, 3 months, experiencing menorrhagia and dysmenorrhea, increased hairiness and increased greasiness of skin.
Yes, of course, because it is again recurred. So we need to mention regarding that.
Okay. Next is our information of 6/4/2019, removal of IUD with nurse prescribed, removal of IUD unsuccessful. Is it relevant?
Yes, it's a relevant point.
Okay. Attempted for 15 minutes, unable to locate string.
Yes, we need to mention regarding that, ma'am.
Okay. Patient can't recall last time strings located.
Yes, it's a relevant. So, ma'am, here whether we need to write both togetherly?
Oh yes. Okay, if you want to reduce the word count, you can completely avoid one sentence. Like you can write attempted for 15 minutes as unable to locate the strings. Okay. And next, moving, pregnancy test administered negative.
Yes, I think it's important one in the case.
Okay. And now the most important thing in the letter is query for IUD shifted or fallen out.
Yes, because this is the main reason why we are sending the patient to the obstetricians. So, ma'am, how we can write the diagnosis?
Okay. So, before that, I want to ask everyone. So, can you tell me what can be the diagnosis of the letter? So, please comment on the box. Okay, so we can start. As I think relevant and irrelevant information is clear in your mind. Since if you have any doubt, you can just comment it in the box and we can move towards.
So, ma'am, let me tell one diagnosis. I don't know it's correct or not, but let me tell you. So, we can write in this letter that she is suspected to have IUD shifted or fallen out. Is that correct?
Okay, I think that's not a correct. Okay, one of the student has written the diagnosis. Book Prasanna has written her intrauterine device is suspected to be shifted or fallen out. That's correct. Okay, because we cannot suspect a person to be fallen or shifted. Okay, in that place we can use it. Her intrauterine is suspected to be fallen or shifted. Is it okay?
Okay, so ma'am, so in the case of conditions, we need to write like she is suspected to have this condition or not.
Okay, if there is a query with the diagnosis, okay, in that case we can use like example depression. In that case you can use if the depression has query. Okay, so we can use she is suspected to have depression. Okay.
Okay, so in case of any devices, you can mention as her IUD is suspected to be shifted or fallen out. So I hope you are clear about that.
Okay, so we can start with the letter.
Okay, ma'am. So here first we can move to the letter format. So first we can deal with the date. So here we can write today's date. The today's date is 6/4/2019. So is that correct, ma'am?
Yeah, but when you write regarding the date, if it is a single digit number, you can use 06/04/2019 and you have to keep a slash, that is 06/04/2019. Is there any other format for it?
Yes, you can write as 06/April/2009. But I think, ma'am, we can't use any full stops or any other comma or hyphenation in while we are writing the date, isn't it?
Yeah, we have to completely avoid any abbreviations in the date and also in the reader address.
Okay, so I hope you are clear regarding that. So, ma'am, let's move to the reader's address, isn't it?
Yeah.
Okay, so here already the address is given. The address is Dr. Miram Shah, Consultant Obstetrician, the Royal Hospital and Lockdown. Is that correct, ma'am?
Yeah, this is the way we write the reader address. Okay, if the name of the reader is not given, in that case, how we can write the reader address?
I think we can write like the Consultant Obstetrician, Royal Hospital and Lockdown. If the name is not given, means it is important to write that the Consultant Obstetrician. Is that correct, ma'am?
Yeah. Now about next.
Yes, next we are going with the salutation. So already here the name is given. So we need to mention as the second name like Dear Dr. Shah. So ma'am, here I have a concern that if the name is not given, so what shall we write then?
Okay, if the name is not given and we are writing this letter to a doctor, so we can use Dear Doctor, or if it is a manager or something, then we can use Dear Sir or Madam. If it is a nurse in charge or nurse or something, we can use Dear Nurse.
Yes, ma'am, that's correct, ma'am. Okay, so I hope that we can move to the reference. Here, the reference means the patient name is given. So we can write reference Miss Olivia Hawthorne and the date of birth. So, ma'am, here the date of birth and age is given. So what we want to write at first?
Okay, if DOB and age is there, so first preference we will give for the DOB. Okay, if DOB is there, we will write DOB, and please keep in mind when you write DOB, you can write Miss Olivia Hawthorne DOB, okay, or you can use reference Miss Olivia Hawthorne DOB to be written down. Okay,
ma'am. So in case of age, the DOB is not given, date of birth is not given, so only the age is given. So shall we write that age 40 year in the down?
Okay, no, we cannot write age 40 year in the next line. You have to continue with the name, that is reference Mrs. Olivia Hawthorne, comma, age 40.
Okay, so I hope that we have completed all those things. So next we can move to the introductions paragraph.
Okay, So, can you tell me what type of introductions are there?
Okay, there are so many introductions are there, like we can start with thank you for seeing, or we can start with the name like Miss Olivia Hawthorne who requires, then I'm writing to refer, and I'm writing to introduce. So is that correct, ma'am?
Okay, so now we can deal with what type of introduction we can use in the letter. So we can start with Mrs. Olivia Hawthorne, that is name of the patient. Miss Olivia Hawthorne requires further investigation and management. Her IUD is suspected to be fallen or shifted. Okay, next is thank you for seeing. Can you please tell me?
Oh yes, we can write like thank you for seeing Miss Olivia Hawthorne who requires further assessment and management. Her IUD is suspected to be shifted or fallen off.
Okay, so is it possible that we can write thank you for accepting?
Ma'am, I don't think so that we can write like thank you for accepting, because this is not, we are not sending the patient for the long term care. So here we cannot write as thank you for accepting. Am I right, ma'am?
Okay. Okay, next is our third, that is I'm writing to introduce or I'm writing to refer. Okay, when you use I'm writing to refer, same you can use as I'm writing to introduce. I'm writing to introduce Mrs. Olivia Hawthorne who requires further care and management, full stop. Her intrauterine device is suspected to be fallen or shifted.
Yes,
is it correct?
Yes. And ma'am, here we can try the different types of introduction while we are writing, which will make your letter more unique, because everyone are writing I'm writing to refer. So if you are making some changes, definitely it will make a good score in your OET writing. And ma'am, here is there any other introductions that we can provide?
Yeah, that is if there is something like if it is a post care and management, if the diagnosis is stroke or fall. Okay, so we can use like example, Mr. X requires post stroke care and management. So we see that our introduction is very small. So what kind of introduction we can add in that
we
case?
can write like I'm writing to briefly outline the present condition of Miss Olivia Hawthorne who requires, or Mr. X who requires post stroke care. So that all is included in that paragraph.
Okay, in such a case already we have mentioned that post stroke care and management. Okay, so already purpose of the letter is care and diagnosis is stroke. Okay, in that case is it necessary to write again diagnosis?
No ma'am, there is no need to write regarding again that she had an episode of stroke, because if you are writing post stroke care, it is completely known that the patient had an episode of stroke. So there is no need to mention regarding he had an or she had an episode of stroke.
Okay, so when you write regarding stroke or MI, please note it that we have to write he had an episode of. We cannot write as he has MI or he has stroke. Okay, so avoid that. You can write he had an episode of stroke and MI. Okay, is it clear?
Yes, that's clear.
And according to us, we like how we can separate purpose of the letter, like care and management. Is it possible that we can write for doctor?
For the doctor, we cannot write like further care and management, because the care is given by the nurses, but those all things are prescribed or advised by the doctor. So if you're writing to a doctor, you can write that for further assessment or further evaluation and treatment or further assessment and management. That is one of the most suitable thing that we can write for the doctor.
Okay, so I think type of introduction is clear. And ma'am, can you tell me like how we can say about the diagnosis? Is it possible that we can use he was diagnosed or he has diagnosed with this condition?
Okay, see, we can write like he was diagnosed with or he has been diagnosed. These two are the correct one, but we can't write like he has diagnosed or he is diagnosed. So that's not is there in the OET letter. We need to follow that he was or he has been diagnosed. So ma'am, when we will write that has been diagnosed?
Okay, has been we will use for a long-term condition. Like it is a manageable but not treatable. Okay, manageable condition like diabetes, hypertension and depression, we can manage it. So we can use has been for a long term conditions.
Yeah, so in case of was diagnosed, that is diagnosed already it was diagnosed, and now it is treated. For example, he or she was diagnosed with chickenpox, so we can mention like that.
Okay, and one more we can use is, that is, he has depression or he has he has this condition. Okay.
Yes, and the one more thing, if any procedures are done, so we can mention regarding the procedure. Okay, so the patient was admitted to the hospital due to fall and T care was done, so we can mention as he underwent total knee replacement surgery, or he is recovering from total knee replacement surgery.
Okay, why ma'am we cannot write has undergone?
Yes, we can write has undergone, but it should be in recent. If the procedure is done recently, then only we can write as has undergone. Is that correct, ma'am?
Okay, you mean recently means today itself?
Yes, today. If the procedure is happened today and today itself the patient is discharging, means we can mention as he has undergone the surgery.
Okay, so also we can use he underwent the surgery, like he underwent TKR today, so we can directly write he underwent if it is done itself today. Okay.
Okay, ma'am.
Okay, so I think all information regarding introduction is clear.
Yes.
Is there anything else left?
Yes, I would like to tell you that if you are writing the introduction, just keep in your mind that we need to keep the 3 P's. What are the 3 P's, ma'am?
Patient name, present condition, and purpose of the letter.
Yes, because we need to mention these 3 things in the introduction paragraph, and there is no need to give a brief big introduction for a letter. It should be in 3 or 4 sentences. That's enough.
Okay, and is there anything left?
I don't think so, ma'am.
Okay, so I want to tell you that one more thing we can write in the introduction, that is, you can add extra piece of information, that is patient age or profession in the intro. So you can see in the letter, that there is extra piece of information is age, and patient is a yoga teacher. So how you can write is Mrs. Oliver Hawthorne, comma 40-year-old yoga teacher. Okay, requires further care and or further assessment and management. Or you can use just age or profession. Okay, if you use this type of introduction, it will be very good to score. Okay, OET full score. Okay?
Yes, of course, because if you are providing a unique introduction, that definitely it will be well impressed by the interlocutor. So definitely they will provide B in the OET writing module.
Okay, because our introduction is the pillar of our letter.
Yes, of course, ma'am.
Okay, so now we can move towards our first paragraph. So can you tell me what information we can add in the first para?
Yes, ma'am. Actually, the patient was here for the removal of IUD, but this IUD was inserted in previous. So I think it may because due to having the dysmenorrhea and dysmenorrhea. So I think we need to mention regarding the from first onwards. Like we need to tell it as a story. Am I right, sis, ma'am?
Yeah. Because first paragraph is the most important para for the reader, because the reader is going to get all the relevant, all the important information from the first paragraph.
Yes.
So we can see from here that menorrhagia, okay, so this was a very important information for the reader because they want to know from the starting. Okay, so we can start from 21/04/2009 or 21 April 2009, Mrs. Olivia Hawthorne has been diagnosed with menorrhagia and dysmenorrhea along with menstrual bleeding for 10 days. Okay, therefore, okay, now you can see that 2 medications are here.
Yes.
Okay, this is ceased or this is stopped to conceive the children. So we can combine it and say, therefore, she was prescribed Circet and combined pill Silset to conceive her children. Okay.
Okay, ma'am. So, ma'am, why we are not writing it separately?
Okay. So, you know, this is relevant, but if we write it separately, we can increase or the word count will be more. So to decrease or reduce the word count, it's important that we can combine it.
Yes, ma'am.
Okay. Next is full stop. Her symptoms return with menstrual cycle and an IUD Mirena coil was inserted.
Okay, ma'am. So we have given that information, but it was happened in another day. So how we can mention that in the writing module?
Okay, I'm sorry.
Which means now again the symptom is worsened and she was returned with the same symptoms on 10th 4th.
Okay.
So whether we need to mention regarding the date in the letter?
Okay, if you want, you can completely avoid the date. You can say subsequently or on subsequent days or on subsequent years or later. You can use these words instead of writing a date.
Yes.
Okay, and one more thing, like in this completely like back-to-back menorrhagia, dysmenorrhea is given. So in place of that, you can use worsening symptom, persisting symptom or similar symptoms. Okay.
Yes, ma'am.
Okay, now I think our paragraph 1 is completed with 4 to 5 lines. We can start with next paragraph.
Yes, ma'am. So we can start with the next paragraph. So in next paragraph we can write like, okay, later Miss Olivia Hawthorne's symptoms has improved and as evidenced by no menstrual bleeding since fitting. That's correct, ma'am?
Okay, there is one more correction. We cannot write Mrs. Olivia Hawthorne. We have to again write the second name. Okay, Mrs. Hawthorne has improved her condition with as evidenced by no menstrual bleeding since fitting. Okay.
Okay, ma'am. And next, her vaginal thrush was treated with Canestrol. That's enough, ma'am, isn't it?
Yeah.
Okay. So later the patient is again came. So we can write like, okay, on 2nd 4th 2019 she visited with the same symptoms along with menstrual spotting for 3 months and increased hairness and increased greasiness of skin. Therefore she was advised to remove the IUD or intrauterine device. That's correct, ma'am?
Yeah. Next, coming to our next paragraph, that is today's information. Ma'am, is it possible that we can write today's information with the past?
I don't think so, ma'am. I think because we can mention today's detail in a separate paragraph which will give a clear picture to the reader. Is that correct, ma'am?
Okay. So we won't write today's information with the past or the social history. And you have to keep in mind, if it is an urgent letter, you can completely write today's information in the first paragraph. Okay.
Okay, ma'am.
Okay. So today, Mrs. Hawthorne intrauterine device removal was unsuccessful as attempted for 15 minutes. Full stop. She stated that she is not able to recall the last time strings located. Her pregnancy test is negative. Okay.
Okay, ma'am.
Is there anything that we have to add?
I think there is no need to mention, but I don't understand what is the purpose we are writing again the pregnancy test.
Okay, as you know that we are writing this letter to a gynaec, so it's really important and relevant information to write regarding the pregnancy test.
Okay, ma'am.
Okay, so next is our request para.
Okay, but ma'am, we didn't completed our social paragraph. So whether we can mention that, no, in the lecture?
Okay, so I will tell you, every time social para is not a relevant thing. If you want, you can add that information if it is relevant in the introduction, first paragraph or in the request para. Okay, so we can see in the social para what are the relevant information. You already know that in the social para, married to son or G3P2, okay, and yoga teacher swims 3 times. Next is our iron deficiency anemia, okay, and next is ferrous sulfate 200 mg per day manning. If you want, you can write social, or in another way that we will be telling you, you can start with Mrs. Hawthorne is it G3P2 or has 3 pregnancies with 2 live children. Okay, she has iron deficiency anemia, or you can use she has had iron deficiency anemia since 2008, comma, for which she takes ferrous sulfate 200 mg per day manning. Okay, and any other information, that is swimming and yoga teacher. She swims 3 times per week and is a yoga teacher for 9 years. Okay.
Okay, ma'am. So here I have a doubt that, so you already mentioned that she has had iron deficiency anemia. So whether we can write like she has had the history of iron deficiency anemia?
Okay, so we cannot say she has had an history. Either you can say she has a history of iron deficiency anemia, or you can use she has had iron deficiency anemia since this year. Is it okay?
Yes, that's correct.
Okay, so I told you that you can avoid social para. So in this you can add like information of yoga teacher in the introduction, and another information about iron deficiency anemia and ferrous sulfate in the request para, and next is also about the swimming, also you can add in the social para. Okay, so can you please tell me how you can write the social request para?
Of course, I will tell that. We can write, okay, so it would be appreciated if you could provide the further evaluation and management for Miss Hodron, or else we can mention regarding the ultrasound, because they have mentioned regarding the ultrasound. So we can mention it would be appreciated if you could provide the ultrasound for if you could arrange, because we cannot tell to the doctor to provide, so we can tell if you could arrange the ultrasound for Miss Hodron. And kindly note, she has iron deficiency anemia for which she takes the medications. Is that correct, ma'am?
Okay, and yeah, like all the information which is relevant we have a mention in the request para. Now I think every information is clear.
Yes, ma'am.
Okay, next we can move towards,
I think we can go through the organization, because here there is a doubt for every student regarding the organization, how we can maintain the organization. So in this letter already we discussed that the symptoms is already occurred previously, so that's why we are provided from the previous. So in case of urgent case, how we can provide the information or how we can organize the letter?
okay, if it is an urgent letter we have to avoid all the connection from the past. If it is urgent letter, we have to write today's information. Okay, if like it was an allergy from with some medication, it started 2 days before, so don't say about when it started. What patient is having symptoms today, you can mention regarding that.
Yes, ma'am, that's correct, because we need to mention regarding the recent or the present history. Okay, ma'am, then in case of social history, so here that social history is not much important, but in some cases we need to mention regarding the social history. If sometimes we need to have the weight count also, so how we can organize that, ma'am?
Okay, so yeah, as you can see in some letter, like I will tell you, it was a venous leg ulcer associated with DM or something. Okay, patient has had this DM from 1990s or something. Okay, so no need to write for telling this that patient had this condition or has this diagnosis in the previous. We cannot write a social paragraph. Okay, because social para may be including the related information related to diabetes.
Yes,
okay, so if you want, you can completely take that line related to diabetes or related to patient's present condition, and you can write it like patient has had DM since this and for which is managed with some medication. Today patient presented with venous leg ulcer, and you can connect and write it.
Okay, ma'am.
Okay, so according to the reader, we have to decide which information is relevant or not. Okay, or which information to be written in the first para or not.
Okay, so that's clear. And I have one more concern that is quite common in every student, that in case of social history, we know that we need to write the first body paragraph as the social history. So it's compulsory to write the social history for the social worker?
Okay, we can say at one point, yeah, it's important, but we also have to see what the reader want. like social worker 1 and what are the information added in the social history. So we cannot say every time for the social worker there will be a social history. We have to read what are the information given. According to that we have to write first paragraph as a social or present. Okay.
Okay, ma'am. So I hope that's clear for all of you. So if you have any doubt regarding the organization and the introductions, you can just comment on the comment box. So we will clear out your doubts.
Okay. So next, can you now next line is, please do not hesitate to contact me if you have any queries.
Yes, yours. Ma'am, here whether we can write like yours faithfully.
Okay. We can use yours sincerely because the reader name is given. Okay, so it's better to write yours sincerely. If the reader name is not mentioned in the writing task, you can write yours faithfully. Okay, so can you tell me, is it important to put a comma after yours sincerely or yours faithfully?
Yes, which means if you are writing in salutation, if you are writing like dear doctor, then if you are putting comma on there, it is compulsory to put comma after yours sincerely or yours faithfully. If you are not mentioning the comma at first, then there is no need to mention at last also.
Okay, so after that, next line is for the name of the registered nurse. If in the right letter name of the registered nurse or name is given, so you can mention in the next line. If it is not given, you can leave one line and start with next registered nurse.
Okay, ma'am, whether it is compulsory to write the name, if the name is given in the case note, it is compulsory to write the name in the case note?
Oh yes. Okay, if the name is given of the registered nurse, you have to write the name of the registered nurse and next you can start with registered nurse.
Okay.
Okay, so is there any doubt regarding?
I think we have completed that, so we can wait for some time. So let us see whether the students have any doubts or not, so we can clear it out.
Okay. Okay, there is one concern regarding the medication. Okay, so we can see how we can write regarding medication. So if the patient medication is still continuing, so we can write as she has been commenced on, or she has been prescribed, or if you're writing medication, okay, she has been commenced on this medication, dose, route, comma, medication, dose, route, comma, and okay, or there is one more method. Okay, she has been commenced on medication, comma, dose, comma, route, hyphenated word, then medication, comma, dose, comma, route. Okay, so this is the method. Is there any other method we can use it?
I think that we can use the simple method because that is more easy for the students to follow also. Otherwise, sometimes there may be chance for making some mistakes.
Yeah.
So I hope that you can write like you can write the medication. For example, paracetamol 500 mg at night. Then you can put comma. I think that is one of the easy and good methods. So it will help us to reduce making some mistake. And ma'am, in case of writing this medication, you already told me that she has been diagnosed with, she has been commenced on this medication. So whether we need to write which needs to be continued?
Okay, if you are writing has been, so you can avoid it to writing regarding to be continued. Okay. And also one more thing I want to say, that if you have to see discharge plan, if in the discharge plan there is information regarding monitoring or continuation, okay, so you can try to connect it with the medication in sentence, like she has been commenced on this medication and requires monitoring. So there should be organization. You have to pick the lines and write where it's needed. Okay.
Yes, ma'am.
Okay, and any other doubts? Okay, so yeah, you can write on subsequent years, on subsequent days, or subsequently, comma. And one more thing I want to tell you, that you can add 2 to 3 connectives in the letter. Don't use more than 3, isn't it?
Yes, that's correct, because if you're writing the connectives also, it should be well known by yourself, because there may be chance for making some mistakes also. So it's better to write 1 or 2 or 3 connective words in the letter, and just keep it in your mind that it is important to avoid starting with the simple connective words like and, so, etc., because we won't start with those things. So you can just avoid using or starting sentence with the simple connective words like and, so, but, etc., like that. So am I right, ma'am?
Yeah. Okay, so one more thing I want to tell you regarding the introduction. There is also a unknown case. Okay, so how we can identify that if the letter is known or unknown?
Okay, well, I think that if it is a non-case, definitely in writing task they will clearly mention that we are writing the letter for a patient's GP, or it will mention the name like Hawthorne's GP. They will clearly mention like that, or else you need to focus on the address. So what are the address we need to mention, ma'am?
Okay, so when you write regarding a known case introduction, so you can write I am writing regarding your patient, or I am writing to update the current health status of your patient name. Okay, other than that, is there any other third introduction?
I think we can write like I'm writing in regard.
Okay, and one more thing, like if you are confused with is it like patient know, if is it possible that patient know the condition or not, in that case you can use one more introduction, that is Mr. or Miss X, one of your patient requires further care and management, or requires assessment and management. Okay, so when we can use update?
I think, ma'am, it's like okay, I will tell by regarding an example. Okay, so I'm a nurse in home care. So I'm the nurse who's taking care of the patients in old age care home. So I know one of my patient was admitted to the hospital because of fall. So until that, I know what all happens until the admission, but I don't know what all happened in the hospital. So we are after the treatment, the patient is coming back to the same old age home. So here they are updating, which means they are giving the information regarding the care which is provided in the hospital. So in this cases we can write like I'm writing to update you regarding the current health status of the patient's name. Am I correct, ma'am?
Okay, so I can give you an example. If the patient diagnosis or the patient condition was diagnosed in the hospital, okay, like UTI, okay, is it possible that GP have knowledge regarding it?
No, ma'am.
Okay, next is if the patient came with a burn or something.
I think that's also not known by
Okay,
the GP.
because it's an urgent case, the patient just had burn and came. Okay,
Yes.
so GP, there is no like GP won't having any information regarding burn or something. So we can write I'm writing regarding your patient. Okay, and when we can like as you said, we can use update.
Yes.
Okay, what can be the example for it?
That's the same thing what I've told, that in case of old age care home. So we can write for if you're sending the patient back to their old age care home. So in that cases we can write mention as I'm writing to update.
Okay, and as I have told you, Mr. X, comma, one of your patient, you can use in any case. Okay, so if you have doubt regarding is it possible that GP has knowledge regarding the condition or not, so you can use this third introduction, that is patient name, one of your patient. And ma'am, some students have doubts regarding a home visit, home visits, and at home care. So can you please explain us?
Yes, ma'am. Actually, if it is a home visit, means they will clearly mention in the writing task or in a discharge plan. We need to which means like she requires daily visits. So daily visits means we can mention as home visits. Okay, so they will clearly mention in the writing task or in discharge plan whether the patient is needed home visits or not. But if you are providing care at home, they will mention like who requires care in home. So in that cases, how we can write the introduction, ma'am?
Okay, so if you are starting with I'm writing to introduce, you can start with I'm writing to introduce Mr. X who requires a home visit or home visits for further care and or further assessment and management. Or if it is at home care at home or something, you can directly write Miss X, Mr. X or Miss X requires further care and management at home, isn't it?
Yes, ma'am.
Okay. Is there any doubts regarding writing modules? Okay, so I think we have cleared your doubts regarding writing. So if you have any doubts, you can just comment it below and we can come to another live session with your doubts.
Yes, ma'am. So thank you for listening us and
Have a good day. Thank you.